So I'm just going to pass it over to Sarah to begin. And if you have any questions, there's a chat as well. And we'll open up the line at the end of the webinar for anyone who wants to ask their questions as well. Thank you.
Thank you. Well, Joel and I are delighted to be with you today. I am really happy to be here. I got home late last night from meetings in Alberta, and I was delighted to see it was spring here, having come from summer in Alberta, where it was 27 degrees in Calgary yesterday. This is really important research, and we're thrilled to be able to share it with you. This is the first research of its kind on this topic, and this is the first time Joel and I have presented in public. We've done several internal presentations to the Electrical Safety Association colleagues, but this is our first public presentation. So we're delighted to be here. We're going to talk to you about one component of our research, and then we want to give you the opportunity to talk about the kind of risk management, risk communications challenges that you face in your organizations. We thought we'd talk a little bit about who we are and what we do, and then Joel is going to set up the challenge from the perspective of the Electrical Safety Association, and I'll talk about the research opportunity, our science-based approach, the behavioral research that we've done, and we want to talk about some of our key results and show you just the complexity of decision-making that electricians face every day on the job. And then we wanted to open up the line, as James said, and have a discussion about how this behavioral approach might be of use to some of you folks in the challenges that you deal with. So let me talk a little bit about who we are, and then I'll get Joel to talk a little bit about ESA. I am co-founder and CEO of the Canadian company of Decision Partners. We have been in business for 25 years. Our third partner is Dr. Brooke Fishoff, and Brooke, some of you may have heard of. Brooke is the leading pioneer in the field of risk communications and risk perception. He is a professor at Carnegie Mellon University in the School of Engineering and Public Policy. And as I said, he's our chief scientist, and he's been with us pretty much since day one. What we do, we have a team of, really a network of social science scientists, researchers, engineers, consultants, all across North America and some in Europe. And what we do is we provide science-informed, evidence-based solutions based on our mental modeling platform. And I'm going to talk a little bit more about what that is and how it works. One of the things I wanted to share with you is that after what seemed like years of paying lawyers, we finally got a patent for mental modeling technology, which is process methods and tools on a software platform that we developed. All of our work for the last 25 years and all of Brooke's work for many more years has focused on understanding what influences people's judgment, decision-making, and behavior. So all of our work is focused on behavioral outcomes, which is why it was of interest to the Electrical Safety Association as they were trying to determine what was influencing the behavior of electricians on the job. One of the things that we say in our work is that really nothing changes until behavior changes. And what we do is we bring the latest advances in behavioral communications and decision sciences, which are an integral part of an integrated risk management system, as I'm going to show you. We bring those to bear through a strategic management format. Behavioral science is getting a lot of attention these days, and I just wanted to show you these two books. You've probably heard about the Nudge book. The Nudge Unit was developed by the British government a few years ago to look at what could be done to nudge people to take the right behaviors. So, for example, if you wanted to start to address the rising issue of obesity in children, one of the nudges might be to build communities where kids could walk to school or ride their bikes to school safely. So that's there's been a lot more talk about nudge, and now we're seeing even as recently as a month ago, the federal government in Canada having seminars on nudge to get people thinking about the application of social and behavioral sciences to helping people make the right decision and take appropriate action. The other book that I put up is a very good reference. I'd be pleased to send it along to anyone that's interested. Our chief scientist, Dr. Brooke Fishoff, is the editor, and Brooke was the first chair of the Risk Communications Advisory Board for the Food and Drug Administration in the United States. We've been working with FDA for over 10 years on basically doing all of their mental models research, and much of our work is reflected in this book. The book is really a simple guide to how to communicate about the risks and benefits to help people make well-informed decisions. And there's a whole lot of focus now in the States, and we're seeing it in Canada as well, for an evidence-based decision-making. So you might find this book useful, and I can certainly send along the reference if you're interested. We say that in order to influence people's judgment, decision-making, and behavior, we have to work from insight into people's mental models. The frame that's in all of our heads that guides or limits what we think and how we think about things and how we make decisions. So I'm going to talk a little bit more about mental modeling, and then I'm going to show you a little bit about the mental models of electricians. We think about mental models really as the brain's operating system. And in order to help people make well-informed judgments and take appropriate actions, which is really the whole focus of risk communication, we need to work from insight into their mental models. Brooke calls them tacit webs of belief, really, that they're below the surface, that guide people's learning, interpretation of information, the complex psychological processes of judgment, decision-making, and ultimately the actions people take, the behavior that results from their thinking. While mental models has been studied since the 1930s, it was really in the 80s when Brooke and his colleagues at Carnegie Mellon did a lot of groundbreaking work on mental modeling, understanding what influences how people think and how they get from one idea to the next. And what we've done in our work through Decision Partners is we've really taken that work from Carnegie Mellon and expanded it, integrated it into a risk management system, and we're now applying it. We've applied it to everything from understanding influences on parents' vaccine decision-making, whether or not to get their kids vaccinated, to understanding the acceptability of nuclear facilities, new 500 kV transmission lines, why people attend opera or not, to everything including biosolids. So the application can be used for really understanding any kinds of complex decision-making. The process is what is the common denominator. Mental modeling is really the preferred approach for discovering. We use mental models to discover influences on people's judgment, decision-making, and behavior. We're not using, it's quite different than opinion research. Opinion research is used to test how many people think the same thing against a set of parameters that you give them. Mental modeling is used to, as I said, discover. And we use mental modeling when what is critical to the success of our client partner is sustained behavioral outcomes, which in safety, the work that Joel's doing, is absolutely critical. I just wanted to put mental modeling and risk communications into a context a risk management context. I like to use the Canadian Standard Q850. All of our work is based on this, in part because I was one of the co-authors. Our contribution to Q850, which I'm sure you folks are all pretty conversant on, our our contribution was really that risk communications piece. And the mental modeling piece, the research piece, really goes in at the front end, doing the preliminary analysis, doing the risk estimation and the risk evaluation of understanding, first of all, what are people thinking against what the experts are thinking. So in the preliminary analysis, we actually do an expert elicitation and develop an expert model. In the risk estimation step, what we're doing is mental models research against that, using the expert model as the analytical framework. And in the risk evaluation, we're working at the technical level with people like Joel to understand what are the primary influences on people's behaviors, and how can you integrate that into suitable risk controls to sustain the behavioral results that you want. So that just gives you a quick overview. As most of you probably know, Q850 is really the backbone of the new ISO 13000 standard. But I just think this is a nice, simple picture. In mental modeling, what we do is we start with understanding a picture of the system at hand. We start by developing a base model, and we do that. It's typically in the form of an influence diagram, and we do that by conducting a lit review, which we did for the Electrical Safety Association, but also expert elicitation, which we do often in the form of a workshop, which is what we did for ESA. So we're looking at what is the system in which, in this case, electricians are making decisions about working energized every day and working safely, or working energized, not working energized. What are they doing to ensure that they're working safely? In the second step, we use the expert model developed in the first step to understand what's actually going on. What is influencing people's behavior? And here we do one-on-one interviews, typically over the phone, to understand not just what people think, but more importantly, why they think what they think and how they get from one idea to the next. And that's what we're going to show you in one piece of the research. We use that, we map the we code and analyze the interview data, and we map it against the expert model. And we can look at the influences, the primary influences on people's decision-making, and also look at where are they aligned, where are the stakeholders that are, whoever our focal audience or stakeholder group is, where are they aligned in their thinking with the experts, and where are the gaps. And when we do our analysis, we're looking at what do people know now that's correct, what don't they know that's consequential, what do they misunderstand, what do they want to know, which is often different than what our client partners want to tell them. And then the last thing we look at is who do they trust and what communications processes do they trust. And once we've figured that out, we can develop very focused policies, strategies, interventions, communications, all focused on helping people make a well-informed decision and take appropriate action. So that's kind of a quick overview of who we are, what we do. I'm going to ask Joel to talk a little bit about the Electrical Safety Association and set up the challenge that we work together on. So Joel, over to you.
Thank you very much, Sarah. So to kind of give background around who ESA is, the Electrical Safety Authority is actually an administrative authority that acts on behalf of the Government of Ontario. And we derive our authority through basically two key legislations. One is the Electricity Act, and the other is the Safety and Consumer Statutes Administration Act. And we are ultimately responsible for four kind of key regulations in the province. The first one you probably are aware of is the Ontario Electrical Safety Code. The second is we also license all electrical contractors and the master electricians in the province. We also are responsible for safety with the utility distribution system. And the last one is a responsibility with electrical products that are from an industrial commercial side as well as pre-customer electrical products as well. At the end of the day, our kind of, long-range vision is, to look to a place where, people in Ontario are safe from electrical harm in anything they do, work, living, playing. We really want to try to minimize the risk of kind of three main things. So that's shock, electrocution, and as well as fires from an electrical source. So our ultimate goal is to find out how we can improve the well-being every day. And through this administrative authority arrangement, our mandate is very broad. We have the ability to use training, authorization, investigation, enforcement, and other things. And research is definitely one of the key factors that we are expanding on, especially with my new role for ESA. Next slide. Each year through that research, we produce the Ontario Electrical Safety Report. And this is one of the only, books in North America that's specifically designed to talk about the hazards related to electricity. So all of the numbers that you see in these next slides are population-based for Ontario. This slide kind of demonstrates the total number of occupational fatalities that have happened from 2004 to 2003. And one of the challenges that we have, it's actually a blessing, but it's also a curse, is that we have very small numbers. As you can see, ranging from 7 to 2 to 8, and the numbers are all spread around. So what we try to do is to smooth this by looking at 5-year averages to try to help illustrate a point. Next slide. So when we do that, we also kind of look not only at fatalities, which is the ultimate end for an outcome, but we also try to examine the concept of what is the precursor event, and that's what we refer to as a critical injury. As you'll see from my bio, I'm a physician and I do a lot of work on a population public health basis in both occupational medicine. And one of the key things that we always look at is what is really the difference between a critical injury and a fatality. Most times it's the quickness or ease that that person is able to access medical care. And that's sometimes is luck. So let's look at the precursor event, the critical injuries and fatalities. And so that's what we did on the slide that's in front of you. This is once again occupational critical injuries and fatalities, a 5-year rolling average of the numbers. And as you can see with the top line, there's been great progress in the occupational sector as it relates to critical injuries and fatalities. But when we take one strata, and those are the electrical trade workers. So we define those as apprentices, the journey persons, as well as utility workers, because we use the National Occupational Classification System, or NOC, that helps really understand what is an electrical trade worker. We see that their pattern is much different. So massive 48% decrease over a period of time, but we don't see the same, rate of decline or the same pattern for electrical trade workers. And for us, this was very interesting. If you know electricians or you know anyone that's in the electrical trades field, these are individuals who are exposed to the hazard on a daily basis. And through the work that they do, what is their risk? And one would think that, you're trained, you're doing things that are part of your education, you would think that their risk or their injury rate would actually be very low, but from the information and the data, it's not the same. Next slide. So when we looked a little further, we were able to kind of create ratios that exist within the electrical trade work industry. 1 death for every 5 critical injuries for every 18 non-critical injuries. We are very mindful that the non-critical injuries and the near misses are sometimes underreported. Once again, individuals may feel that they have received some type of injury that's not significant, and therefore, I'm not really going to report it. But at the end of the day, contact with electricity is something that is very unforgiving. And recent research that has been performed both here in Toronto with a group out of Sunnybrook and Sick Kids, that was later reconfirmed with a group in Alberta in 2013, indicates that even, a person may receive a shock of any voltage, low or high, but the long-term after effects are still present up to 18 months post-contact. And those are issues both around numbness, tingling, tongue issues, as well as some of the psychological contacts of post-traumatic stress disorder. So we are really trying to work to find out how do we prevent these injuries from happening. And that is really one of the key questions that we have is, we know that in order to prevent an electrical contact, the easiest way is to de-energize the system. Next slide. But we know that that isn't always happening. So the slide that's in front of you talks about what type of work is being done when we see these fatalities happening. And the number one cause is repair and maintenance. So there is some type of device, motor, or switch that needs to be repaired or replaced. The work is being done on a live system, and we see that this is happening. Next slide. The biggest item that we've been able to identify is about an improper procedure. So the question that we wanted to talk about is, well, why is this happening? The group is trained professionals, they've gone to school, they understand what the hazards of electricity are from a body systems perspective, but yet there's still this question of, I'm working on this equipment energized. We did some preliminary analysis that kind of helped give us direction. And in that preliminary analysis, it was really identified that it was individuals who are kind of the mature electricians, not the apprentices, but someone who's been working as an electrician for many years, doing the type of repair and maintenance activities which is considered bread and butter, repairing a panel, putting in new fuses, changing a ballast on a 347 volt system. So things that are typically part of a standard electrician's day. But we were still trying to understand, well, what are the behaviors and judgments that are driving this working energized? And so we approached Sarah and her team to really help us understand. And that leads us to the next slide, which is really the basis behind why we wanted to do this research. So at ESA, our overall corporate goal and strategy is to have a 20% reduction in both critical injuries and fatalities in the province over the next 5 years. And in order to do that, we really have to be proactive, because once again, a fatality, you can't really be reactive after the fact. Also, when the injury happens, the difference between the injury and the fatality sometimes is luck. So if we were able to go back, understanding all the data that we have, repair maintenance activities, improper procedures, what are the basis behind those electricians that are in the field doing the job, to understand what is it that is driving their behavior. So that's the basis of why we were interested in the work that Sarah and her team had done, and we wanted to learn more. So Sarah?
Great, thank you, Joel. So we started working with ESA in the early summer. We started by developing the research opportunity statement, and then we developed two different models. One was a stakeholder map, and the second one was really this expert model called Influences on Electrical Workers' Judgments and Decision-Making Regarding Electrical Safety Practices. We developed that by conducting a very comprehensive lit review, and which interestingly, there wasn't a lot of behavioral work that's been done anywhere in the world around electricians' decision-making. So this is really groundbreaking research. There also aren't a lot of organizations like ESA, which is also interesting. So we brought together an expert panel of people, different regulators, ESA experts, as well as electricians and people that manage electricians and the training organization. So we brought together a bunch of different expertise to help us develop this model, which we then validated with the group. And then we use that as the analytical frame to conduct mental models research with 60 electricians, and we followed that with 11 inspectors. And you can just see our interviews average 45 minutes in length with our electricians. These are one-on-one interviews over the phone, and I think that in both cases, the electricians and the inspectors, the length of time that we spoke with them and the quality of the interviews really reflects how serious this issue is to electricians, and I'll talk more about that. This just gives you a sample, picture of our sample frame. We wanted to get some apprentices, but as Joel said, his data indicated that the people that were at most risk were people that were primarily men in their mid-40s who'd been working as certified electricians for quite a long time, probably 15 or so years. So we wanted to get an understanding of the mental models, the variances between apprentices and journeymen with different levels of experience. And we also wanted to understand the difference between, see if there were differences between large and small organizations. The hypothesis of the experts was that the larger electricians working in larger organizations would probably follow their training and the rules more closely than individuals or people working in small shops. We sent out through ESA, sent out an invitation for people to participate in a screening survey, and we had a huge response just about overnight. As you can see, we had 1,576 people respond that they were interested in participating, and I think that that was really, really significant in terms of their level of interest, but also, as you'll see in our recommendations, the acceptability of using the web and a computer interface. We'll talk more about that. The interview protocol, as I said, is open-ended. Mental models research is used to discover people's thinking, what they think, and how they get from one idea to the next. So it's a very open-ended process, although it's very carefully constructed. And our interviewers are trained to prompt and ask the interviewee why they think what they think, so that we can really understand the thinking. The protocols for both the electricians and the inspectors were developed based on the expert model. That's our analytical framework. And we started by talking about personal influences on their safety behaviors. We then talked about project and worksite influences on basically electrical workers' safety overall. And then we talked about specific training guidelines and communications to understand how those components really influence their decision-making and their ultimate safety behavior. One of the things that the research does is it lets interviewees speak about what's important to them. So we learned a bunch of things spontaneously from that were raised spontaneously that added depth and also insight to our report. I'm just going to give you the bottom line and then talk about one component of our research. So here's the bottom line. This is what we presented back to Joel's colleagues at ESA. The first is that working energized is a fact. ESA would like people not to be working energized, and all of the health and safety data really points to not working energized. The training points to not working energized, and yet 90% of them are working energized. And we're saying either by choice or inadvertently. And I'm going to show you what we learned in the research and how we broke out those choices. What we learned is it's a very, very complicated decision, and it's not do I work energized, yes or no decision. It's a very complex decision. So what we did following the analysis of the interviews was we actually developed a decision tree, and I'm going to walk you through that because I think it's kind of neat. And I think that the decision tree is a really important decision support tool now for Joel and his colleagues at ESA to use as they work on interventions, policies, communications, training, all that sort of thing. One of the key things that we learned is that everybody's motivation is to get home safe, and that's basically their language. They want to get home safe and sound every night, and that's the primary driver in their behavior, far more than regulation or enforcement. They're self-motivated. They're also motivated to coach and support peer electricians. They're very conscious of the safety around the safety of the people working with them and around them, in part because it affects their own safety, but also to keep younger apprentices or people recently certified, keep them safe as well. And one of the things that we learned is that they're very big on sharing best practices and key learnings from personal experience. Several of the older 10 years plus electricians talked about having to learn from what they said the school of hard knocks, and that they didn't want other people to have near misses. They didn't want them to have to learn from their own near misses, that they can share these experiences and hopefully prevent near misses, which Joel and his colleagues don't have the ability to capture near misses. They do get critical incidents, critical injuries. So below those are probably a lot more near misses. And the electricians were very keen about sharing those and preventing those in future. One of the things that we demonstrated for ESA was the complexity of the workforce and how dynamic it is. Basically, every single day, every job that an electrician does is different with many other factors, with many dynamic factors, and they have to really be on the ball and really be really conducting a risk assessment for every new job that they take on. Interestingly, only 50% recorded doing a formal hazard assessment, even though that's part of their training. And so one of the things that we comment on and make recommendations on in our detail report is that the current formal training in school and then the apprenticeship in the workplace doesn't appear to be adequately preparing electricians for the decisions that they need to make on the job and for the actions that they need to take in complex work environments. And one of the cases in point is the decision to work energized. So that's the one that we thought we'd focus on because it's the leading cause of incidents from based on the data that Joel had showing you. I just want to show you a few things that we found, and then I'll show you the models. Basically, electricians were asked early in the interview to describe the goals they had for the projects or jobs, and all of them, you can see, all of them talk about doing a good job getting home safe at the end of the day. Some of the other things are important, but they're not the most important. And I just wanted to mention, in mental models research, all of these categories are the language that the interviewees used. It wasn't us asking people it's not opinion research, how many people would say this or that or the other thing. This is self-generated. We're just rolling it up and presenting it in bar charts to give an overall impression of the most salient factors that are influencing their decision-making. When we asked them about the most hazardous task, it was interesting that inspectors and electricians viewed the work site differently. Inspectors thought working energized was the most hazardous task, And electricians talked about that, but they also talked about working at heights and working on high voltage systems. One of the things that is important here is that inspectors cannot be used as proxies for determining how to communicate with electricians, because they think differently. They're in a different place. We said working energized is a fact, and I mentioned 90% of them are working energized. They all said that they were confident they could refuse to work energized and felt comfortable about doing so. The reason they're working energized, they told us, is because they have to. They believe they have to. And again, this is mental models research is perception research. They believe they have to due to the nature of the task. They mistakenly believe they have to because they lack knowledge or they have critical misunderstandings. They choose to, knowing that it isn't necessary, but because of personal preferences, they want to get the job done by the end of the day and get home for dinner, or external pressures, the boss, the client, somebody's telling them they can't, they need to work energized so that they don't shut the place down. And there are a bunch of other actions that can cause them to unknowingly work energized, which I'll show you. One of the things that we mentioned to the ESA team is that the campaign that they've been running now for several years, Don't Work Live, is a negative that reinforces a negative. And that's one of the things that we suggested they consider going forward if they want to help change people's mental models and change their behavior about working energized. When we asked about who decides whether or not to work energized, the electricians said it's basically my own decision. 40% said it was their own decision. Some said it was decided by others. It could be their superior that they're working with, electrician. It could be the client. Sometimes it's just the situation. The inspectors thought it was really the electrician's own decision. Some said it could be decided by others as well. So there's a number of factors that go into working live. And what we did was we pulled these out and drew a decision tree. I'm just going to go on to that. I talked about the formal assessments. I want to talk about the decision tree because I think this is really an interesting result for ESA. It is not what the expert panel expected. They thought it was more of a yes or no decision, but this is a much more complex decision. And I'm going to show you this to show you the complexity, and then I'm going to break it apart. But basically, if you look at the decision points, there's a decision first of all to conduct a hazard assessment. Some do, some don't. Over 50% are not doing a hazard assessment. There's a decision to work energized. And then if they work energized, there are a number of different outcomes. And I want to show you what those are and show you how this decision tree comes together. The first is really the decision to work energized, and that's influenced by motivational factors, getting home safe at night, finishing the job, contextual factors, the complexity of the job site, the number of trades involved, people breathing down their necks saying, they need to get on with the next job, and they need this electrical piece done quickly. Some of the organizations don't want to have the client organizations don't want to have their power shut down because of the cost to their production or because of the risk of having a hospital or a critical organization like that without power for a period of time. So there's a whole bunch of contextual factors, and then there's the risk perceptions of the electrician himself or herself, and their belief about whether or not the task must be done energized. Some believe that there are some critical tasks that must be done energized. So the first thing they do is either they decide to do a hazard assessment or not, and the next decision is whether or not to work energized. There's two ways that decision can go, yes or no. So if we move on to the next piece, if they decide to work energized, and it's a yes, there's basically three things that can happen. One is they can work energized appropriately, although there are some in ESA and some of our expert panel that would say there is never a need to work energized, so there is no appropriate working energized. But some of our electricians believe that you can work energized appropriately and with knowledge. Knowingly working energized and taking the right precautions, wearing the right gear, conducting your hazard assessment, making sure you've got the right protective gear and all that sort of thing. The second decision is really working energized, but with knowledge gaps or misconceptions, either about the need or about the equipment required, or about the hazards of doing so. And the third choice is really taking the risk of working energized by choice, even when it's not necessary. And that's, for example, working energized because you don't want to take the time to shut down, to do the proper lockout procedures when it's just going to be a quick job. You've done it a million times before, and you really just would like to get home and have dinner with your family. So there's that sort of thing happening in that one as well. For each of these, the potential interventions by ESA and others are different for each one of those decision points. The other decision, of course, is to not work energized. And here, we found out that this is not as simple as a yes/no decision either. Sometimes it requires negotiation at the job site with the site superintendent, with the client, or with other trades. And one of the gaps that we found in our research is the risk communication skills that electricians have coming out of formal education are probably non-existent. They're probably learning on the job, and that's a gap and an opportunity from a training and formal education perspective. So here they can decide not to work energized and refuse the job. But one of the things they said is if they do that, sometimes somebody that is less skilled will get asked to do the job. So the job will proceed anyway, and they don't want that to happen and put the site at risk or put the job at risk. Okay. And then sometimes they decide to de-energize. They think they've de-energized, and they find that they're unknowingly working energized because somebody else, another trade or whatever, another electrician or another trade on the job site has re-energized the site that they're working on. And we heard about a number of near misses that people have experienced just because of that. So even if they choose not to work live, sometimes it happens. So when you roll it up, it's a very, very complex decision picture. This is what electricians are facing every day on the job. And if you look in the yellow box, what we're showing there are the number of different kinds of interventions, contextual, motivational, risk-based interventions that could include training, communications, better tools, protective gear, different processes, different reward and recognition processes, and including enforcement by inspectors. So the very, very complex picture, but I think by taking it apart this way, we've provided ESA with a decision support tool that they can use to get underneath each of these variables and develop appropriate interventions to hopefully address the goal that Joel stated at the beginning of our presentation. So at the end of the day, our strategy for ESA and our recommendations was really to be a catalyst in the establishment of what we would say a culture of safety across the profession that will produce sustainable, measurable behavioral outcomes year over year. And the first component of that was really supporting the establishment of an electrician-focused community of practice. Remember I said electricians had talked to us about their experiences, near misses, and their desire to keep themselves and their colleagues safe, and their willingness to share their experiences to keep those coming up in the trade safe. So we think that that could be a really valuable sort of center point going forward. And then the second is really fostering the development of appropriate training and decision support tools to support them with these on-the-job decisions that they face every day. Primarily the hazard assessment, coming up with, there are tools for hazard assessment, but coming up with simple hazard assessment tools that will help them in the context in which they're working, maybe on PDAs and that sort of thing. Helping them, giving them the tools to do a mental rehearsal. And what they are supposed to be doing is the hazard assessment and working it through with a colleague, a buddy electrician, to make sure that before they start the job, they've thought through all of the potential risks and mitigations. And they are trained to do this, but as I mentioned, less than 50% say that they're actually doing this. So giving them the tools and the training to do that. And then giving them the communication skills and tools, including risk communication, to help them communicate with their peers, other trades on the job site, and possibly their clients, to help them make better informed decisions about working energized and being safe on the site. And our third recommendation was really to engage the inspectors in a much broader role as safety advocates, not just, use carrots, and sticks, but as safety advocates, and providing them with the tools and training they need to be successful coaches, enforcers, and monitors, particularly in situations around working energized. They often don't see it on the job. They're inspecting after the fact. And if there was an opportunity for them to be coaching and able to help people make better decisions, we believe that the safety outcomes would be improved. So just to put in a picture, all of these components are important. They all have to work together to ensure the safety of electricians on the job. At this point, we haven't said how much of each of any of these, what the balance is, just that they're all required and they all need to be in balance. And this is one of the pieces that Joel and his team are now looking at, what under each of these categories, what's the role of ESA and what's the opportunity going forward based on the results of the research that we've conducted. So Joel, can you just talk a little bit about what you're doing now?
Yes, so thanks, Sarah. So as you've seen, a lot of great work that has been produced to help us. And now my fun begins working with my team and the rest of my colleagues here at ESA is to really try to synthesize the findings. From a technical standpoint, we know what the hazard is and its unintended consequences. But the question is, how do we now minimize the risk of working energized and minimize the risk of the critical injuries and fatalities? You've heard that there are a lot of different factors that are now coming into play, and one for us that was very illuminating was that the electricians on the job site are not just solely concerned about their hazard, but how they also interact with the other trades as well on the work site. So as we're developing programs, as we're developing initiatives, not only ourselves but with the Ministry of Labor, the Ontario College of Trades, the WSPS, WSIB, all of the different stakeholders in the safety system, how do we use this lens to help us with our planning processes, but as well as evaluation? When we are developing a program, do we have the appropriate outcome measures that can measure change in behavior that is tied to the outcomes of improved safety? Once again, different ways of communicating with our stakeholders. We've heard that, working energized and don't work live, and, what is the best message that is, potentially in a positive space instead of working on the negative opinion. And then as well as, just continued research. Sarah had a great concept at the very beginning when they were doing the literature review for us. There isn't a lot of work that has been done in this area. So, one of ESA's, as we said, going back to our articles of incorporation, many different things are at our disposal, and research is one. And this is one of the avenues that, we can continue to work with our partners and stakeholders, because at the end of the day, each one of those data points was an individual. And it's not just about data, but it's about the lives of those who are coming into contact with the hazard that we're trying to improve. Sarah?
Great. Well, we really appreciate your thoughts, any feedback that you have, any questions, we'd be happy to take. And we're also would love to talk about the kinds of challenges that you face in your organizations and how this behavioral science approach could add value to those challenges. So, James, if we can hand it over to you, maybe you could moderate for us.
Yeah, I will open up the line if anyone has any questions. No questions came through the chat. So if anyone has any questions they want to ask.
Hi, James. It's Stephen Kelly.
Hi, Stephen.
Now, one of the questions I was asking is that we saw the difference in the disparity between what was happening from the number of incidents that were occurring compared to those that were specific to electrical incidents. Do we think where the electrical incidents were increasing versus the decrease that was occurring generally, do we think that is a result of the increase in population and the population's reliance upon electricity? Is there any correlation that it was to do with other factors other than just working? Is the increase as a result of increased use?
Well, hi, Stephen. It's Joel. So we did actually do another analysis that did try to control not only for labor force size but population size, and we did see a slight change in some of the unionized workforce, if they were a union versus a non-union workforce. But from the other population perspectives, there was no difference to account for the change in slope.
Okay, thank you.
Thank you, Stephen. Anyone else?
James, this is Valerie Fox.
Hi, Valerie. You can go ahead.
Hi. The ESA example was a great example. Thank you. It was an excellent presentation. It applies to a fairly well-defined group. I'm just wondering, maybe for Sarah, if there's any thoughts on how mental modeling can be used on a larger scale. For example, distracted driving is becoming a growing societal issue and risk, particularly related to commercial fleet operators. And those are certainly decisions and behaviors-based issues. So I'm just wondering if there's any work planned or being done with transportation associations, Ministry of Transport, police, et cetera, on that issue.
That's a really good issue, and it would be a really good mental models focus. We have done work on transportation previously around with NAV Canada, airline transportation, but not we haven't done road safety. Although we were looking at that issue in the States with long distance drivers and distraction. So I think it would be very topical. In mental models research, we use fairly small cohorts, and because the interviews are very in-depth, and we really interview the people at most risk. So we work with people like Joel, who've done the risk assessment, to really focus in on who are the critical populations and we do mental models with them. So if we find out that in transportation that distracted drivers, truck drivers are, between 45 and the ones that are having the incidents are between 45 and 55 years old, and they've been driving for X number of years, and they're driving, these kinds of distances, that would be our focal cohort. But we also might do other sort of secondary cohorts as well to compare them. If we need to do a broad-based sampling, typically what we would do is start with the focal cohort, and then we develop mental models-based survey that we do either web survey or over the phone to get a larger population base. But that would be a very good topic.
All right, thank you, Val. Anyone else?
Actually, it's Val again. I have another question.
Okay.
Go ahead.
You talked about the strategic opportunity with ESA for sustainable, measurable behavioral outcomes year over year. Were there some specific leading risk indicators that you were able to identify that are going to be monitored going forward?
Hi, Val, it's Joel. That's actually the next phase of our research. So we do have internally some of those leading indicators, but also some laggings as well. Because ESA doesn't license the electrician per se, we license business. We are looking at how the business would be able to help us through the process as well. But that's the next phase that's coming up.
Okay, thank you.
All right, thank you again. Any other questions? All right. I think that was about it. So thank you, Sarah and Joel. It was a great presentation.